Good evening or good afternoon, everyone. We are all here from Vot-ER to talk to you very quickly about our March 2022 Social Work Healthy Democracy campaign. My name is Ryan, and I'm here with two of my colleagues, Madison and Courtney. We're all interns here at Vot-ER and also students at the BU School of Social Work, getting our master's in macro social work. So we wanted to go and talk to you a little bit about Vot-ER before we launch into the ins and outs of the campaign. So Vot-ER is a nonpartisan voter registration organization that integrates voter registration into the healthcare delivery system. Our vision is healthy communities are powered by an inclusive democracy, and our goal is to exponentially scale voter access within America's healthcare system. Vot-ER was founded by Dr. Alistair Martin. He is an emergency medical physician who practiced at Massachusetts General Hospital here in Boston. And like so many nurses, social workers, and medical students, he went to work every day knowing that he would meet people that he could not help through medical care alone, as simply there just aren't prescriptions or procedures to fix things like homelessness, hunger, illiteracy, joblessness, or violence. And these are the larger forces that are responsible for many people's poor health and their reliance on emergency rooms and community health centers. So this is why he decided that he wanted to start an organization to integrate this voter registration through healthcare. And I'm going to kick it over to Madison to continue to talk a little bit about what we're doing at Vot-ER.
So we see that when patients don't vote, campaigns are less likely to address their needs in healthcare policy and resource delivery. This further negatively impacts their health. Patients that don't vote are frequently labeled as unlikely voters and, as you can see in this visual, are not contacted by campaigns about voting, which leads them to not voting, and the cycle continues. So it follows then that when our patients vote, campaigns are more likely to address their needs. Healthcare providers that promote voter registration help lead to people voting, who are then labeled as likely voters, so campaigns begin contacting them, which creates a positive feedback loop instead of the negative one we saw previously. So as seen in the NASW's Code of Ethics, we as social workers are responsible for enacting social change through social and political action to promote the general welfare of society. Registering people to vote creates change on macro, meso, and micro levels. On the macro level, we see healthcare policies and resource delivery more informed by those the most impacted. On the meso level, there is better provider burnout resilience through empowering their patients to be civically engaged. And finally, on a micro level, as patients are advocating for themselves and their needs, we see better client outcomes.
Wonderful. Thank you so much, Madison. So what is the Healthy Democracy Campaign? So the HDC is a grassroots, nonpartisan, student-led voter registration campaign that takes place in schools of social work across the country. We at Vot-ER, we provide the tools and the training to help you mobilize your fellow students and yourselves to get out the vote in your community. You can register friends, family members, colleagues, fellow students, and even clients. And your activities for voter registration, they aren't limited to just on campus, and they can be conducted in any location. We always just add the caveat here that you're encouraged to have conversations with your field supervisors to see if it can be integrated into your field supervision, but also just to ensure that you have permission to conduct any kind of voter registration activities in your placement as well. So how does it work? So here we have a QR code or a text code that when you are registering someone to vote, you direct them to either scan the code or text BUSSW to 3444. And what it does is it takes your client or your colleague, friend, family member to a landing page where they're either allowed to click a button to register themselves to vote or to vote by mail or even to request a mail-in ballot. And then next slide, please. And one of the fun things that we really like to highlight about this campaign is the impact board. So it'll allow you to stay updated on your team's growing impact during the campaign. It includes real-time tracking of the Healthy Democracy campaign's total impact. And each time your landing page as a BU School social work student is visited, you get a point for your team on the board. And so the impact board will only reflect individuals that you've helped using your school-specific QR code or URL.
All right, and I'm just going to wrap us up here. So we're super excited to hopefully have you all join us. From last year's campaign, we heard back from students that the materials that Vot-ER provided made it easy to approach others and start this conversation about voter registration. And it also empowered students and made them feel like they learned more about themselves and their values, as well as really improving overall their knowledge. And in that sense, it was really an eye-opening experience for them. So what about our next steps? If you are interested, feel free to contact Ryan, myself, or Madison, or all three of us. Our emails are here on the slide. And we're going to get started in March, on March 1st, in celebration of Social Work Month. If you are not able to join, please feel free to spread the word and share that with, share our contact information with any colleagues or fellow students. And just a reminder for yourself and for any students that might be interested in joining us, you are welcome to dedicate as little or as much time, whether that's a one-off event or working to help coordinate and organize other students across campus. And lastly, we just ask that you follow Vot-ER on social media. You'll see our handles here. You can keep track of all the events that are happening across the country at other schools of social work, as well as here at BU. Hopefully we hear from you, and please reach out with any questions. Thank you.
Thank you.
Thank you.